Good morning. My name is Deborah Odokant, and I'm a member of the National Academy of Medicine Organizing Committee on Assessing Community Engagement. I'm also founder and executive director of the Health Education Council, a private, nonprofit, community-based organization, which for over 30 years has been devoted to reducing health inequities amongst diverse, historically excluded communities in our region. I come to you from Northern California in the native land of the Miwok tribes. I'm so excited about the release of the Achieving Health Equity and Systems Transformation through Community Engagement framework, which you'll hear more about during our time together. The very title of this framework recognizes that authentic, robust, asset-based community engagement that builds on existing resilience in residents is essential, foundational element to sustainable systems change and transformation. We've long known that core principles of community engagement, like trust, setting a power-neutral table, leading with equity, consistency, shared decision-making, and others, are at the center of how to engage. The foundation of our work at the Health Education Council has and continues to be community engagement and multi-sector collaboration, key to creating healthy communities. As a community practitioner, I've long known and experienced that resident-driven solutions lead to relevant, sustainable change and changes in systems of health. In our work, often we base our programs on documented needs and data only to pivot our priorities, programs, and approaches when we truly listen to residents. This has happened with obesity, pivoting to community safety initiatives, hypertension, prevention and control efforts, pivoting to neighborhood connection and social cohesion programs, just a few examples of how we change when we truly listen. As we emerge from the pandemic, we are mindful that we have experienced simultaneous health, economic, education, food security, environmental, mental health, racial and social connections crises. The pandemic, which clearly exposed inequities so shallow under the surface, has brought a sense of urgency and accelerated commitment to community engagement done in a different, more thoughtful and accountable way. Community solution making to improve systems of health cannot be approached in a status quo manner. In the past, community engagement impact was often viewed as a soft and squishy process, and its impact not fully recognized. Given the complexity of what contributes to health and well-being, measuring and defining community engagement, grounded in community definitions and the scientific literature, has been a step that is most needed. The National Academy of Medicine process of measuring and assessing impact serves to legitimize community engagement as defined in the literature and community wisdom, elevating, documenting, and reinforcing that community engagement is essential to health systems change to improve health outcomes for individuals, families, and communities. I look forward to learning from all of you who lean into asset-based community building and the resilience that exists in communities to transform our systems of health.